Good morning, everyone, and thank you for joining us for the second session in the Center for Disability Empowerment's Emergency Readiness series for individuals with disabilities. My name is Marlee Sade, and I am the project manager for this grant. I am a wheelchair user with brown curly hair that is in a messy bun on top of my head. I also have brown eyes, and my pronouns are she and her. Today's presentation is on emergency readiness and intersectionality, how class, gender, ethnicity, ability, etc. play a part in the services we may be receiving during an emergency. And we have two presenters for you today. We have Valerie Novak. Say hi, Valerie. And Valerie is a disability policy researcher focusing on inclusive infrastructure and emergency management practices. She focuses on integrating the expertise of lived experience and grassroots efforts for marginalized people into policy making at the local, state, and federal levels. Valerie started at a CIL, Center for Independent Living, before becoming a 2019 Portlight Fellow focusing on legislative solutions to inaccessible emergency response practices in the United States and in the United States. She is also the founding board chair of the Partnership for Inclusive Disaster Strategies. Currently, Valerie is a policy fellow with the Disability Justice Initiative at the Center for American Progress. Novak has a bachelor's degree in disability studies and urban planning from the University of Toledo and a master's degree in disaster preparedness and emergency management from Arkansas State University. She is currently pursuing her PhD at Utah State University. And our next presenter would be Justice Shorter. Say hi, Justice.
Hi, everybody. It's a pleasure to be here.
Thank you for joining us. Justice, let me tell you a little bit about Justice. It's pretty awesome. Justice is a national expert on disability, inclusive disaster protections, emergency management, and humanitarian crises and conflicts. At present, she advises America's 57 protection and advocacy agencies for people with disabilities. As a youth journalist in 2005, Justice began writing professionally on topics related to community development, humanitarian efforts, and youth empowerment. Driven to action by these issues, she has studied community development in South Africa, peace and post-conflict reconciliation in Uganda, Rwanda, and periodically returned to her childhood community to teach on subjects surrounding social action and communications. While earning her master's in sustainable development, international policy and management, Justice authored 3 separate inclusion guides for the U.S. State Department and produced multiple people-centered projects via internships with the Hunger Project, World Learning, and Women Enabled International. Justice also interned within the White House Office of Public Engagement and Intergovernmental Affairs, where she focused on disability outreach efforts, social inclusion policies, and federal agency management. In more recent years, Justice served as a disability integration advisor with the U.S. Federal Emergency Management Agency, deploying frequently to disaster areas across America and its territories. With a steadfast commitment to international development and inclusive humanitarian assistance, Justice continues to participate in ongoing projects as a global advisor and trainer. Welcome, Justice and Valerie. I'm really excited for your presentation. But before you get started, I have a short little disclaimer that I would like to read off, and then I will give you the floor. The Center for Disability Empowerment stands in support of social justice, be it racial, sexual, or disability. This presentation is not a debate regarding the validity of the existence of discrimination. Should you wish to have that discussion, feel free to reach out after the presentation. This presentation was developed and is meant for those who are interested in learning more about how sexuality, ethnicity, ability, etc. affects the emergency services an individual receives. Anyone who makes hateful, antagonistic, or gaslighting comments will be removed from the webinar, no questions asked. So please be kind, be respectful of our presenters and their experiences, as well as the experiences of others in this presentation. And now I will leave it to Valerie and Justice to take the floor. Or the
Wonderful.
platform.
Thank you. Thank you so much, Marley. We appreciate that. All right. Well, this is Justice Shorter speaking, and I'm going to get us started off here. Valerie and I will be piggybacking off of each other a lot throughout this presentation. Just to give you guys a few points of awareness here as we ground ourselves, please know that Valerie and I will be checking in with you periodically throughout today's presentation. So we're going to have a full section towards the end of the presentation, hopefully a good 30 to 25 minutes that's just full of discussion. So if you don't get a chance to ask your question as we go, please feel free to just jot it down or try to remember it so that we can come back to it during the discussion portion. But if you just cannot wait because something we said was so captivating, by all means, feel free to ask that question throughout. Marley and Jamie will be taking note of some of the questions that come through the chat. So please just be mindful that we'll try to get through them as we go, as we kind of transition between each other and presenting on different aspects of today's material. We will naturally have some pauses and some gaps in here to make sure that we're getting at some of the comments, the questions, even some of the experiences that you'd like to share as well, right? Because all of that contributes to the conversation, and we want to make sure that you feel a part of this the entire way. Hopefully everybody here knows how to use Zoom, but if you do not, please feel free to throw that into the chat or ask a question. I'm sure Jamie and Marley would be more than happy to provide you with additional technical assistance should you need it. There's also a captioner available, and I believe that that person has been labeled captioner. So if you need that reasonable accommodation, it is also available. The last thing that I will say is that Valerie and I both speak very quickly. So if you need us to slow down at any point, please don't hesitate to just let us know. And with that, I'll get into it and just give you a quick description of me, and then we'll go straight into this presentation. Again, my name is Justice Shorter, and I am a Black blind lesbian woman coming out of Washington, D.C. by way of Milwaukee, Wisconsin, where I was born and raised, so a Midwest girl at heart. I am also going to be utilizing a screen reader today, so please bear with me as there will also be some natural pauses and gaps in my speaking. You did not lose your connection, it's just that I need to hear the content on my screen. I will also be verbally asking Valerie and Marley and Jamie perhaps, but primarily Valerie, if she can just confirm some of the content on the screen so that I can make sure what I'm saying is in sync with what you guys are seeing. And then lastly here, I live next to a fire station, which is pretty fitting given that we're talking about emergencies and disasters. So you may hear some fire alarms going off in the background. Don't worry, I am safe. It is just sirens streaming back and forth throughout my window. With that said, Valerie, can you confirm to me that we are on the second slide that says, what is disability justice?
Hello all, this is Valerie Novak, and we have our presentation here. We will be doing, we intentionally didn't do a whole lot of images, so we didn't have to stop for a lot of image descriptions, but to give you an idea of what I'm showing on the screen here, I am a Black and Latina femme presenting person with Black curly hair and Black frame glasses, and I'm sitting in a kind of office type room at the computer, and as Justice said, we'll be going back and forth, but we'll try to be as intentional and consistent as possible with making sure that you all know exactly what's going on the screen. Just so that you know, the PowerPoint is pretty text heavy. We will not be reading every single word on the screen, but I do believe you all will be getting both a digital version of a handout from us, as well as have access to the PowerPoint. So you would be able to, read everything that's on there later. We also have a lot of sources linked in there for you that you're able to use, but we will not be reading word for word what's on the screen, but we will try to make sure that, everything that's on the screen is covered, and if there are images that we're providing descriptions for those. All right, you are ready, Justice.
Thank you for the reminder. And I'm always so happy to hear you describe yourself and all of that. I always love hearing image descriptions of folks. So thank you, thank you. All right, so we wanted to get into this with just giving you guys a basic understanding of what disability justice is, and kind of really looking backward to understand the history of disability justice just a little bit. Given that our entire presentation really revolves around this primary framework, which was created by Sins Invalid, which was a performance-based group coming out of the West Coast, the Bay Area in particular. And the real origins of disability justice began back in like 2005, where you had a group of friends. It was really three queer disabled women of color initially, that being Mia Mingus, Stacey Park Milburn, and Patty Burns, coming together to have these initial discussions, and that eventually expanded to phenomenal folks like Libra Moore and Eli Clare and Aurora Levins Morales and several other amazing forward-thinking leaders in this space to kind of get a better understanding of the complexities of disability, and really centering it on people who have multiple identities, many of which are marginalized as well. So it's really looking at the different ways to bring forth access, to bring forth fairness, inclusion, and justice for people with disabilities, many of whom have probably and legitimately felt left out of the larger disability rights narrative and conversation, right, have been erased from a lot of those conversations and discussions. So finding a place that was far more inclusive and far more representative of the stories and the narratives that don't neatly fit within a rights-based framework, but looking beyond that. So understanding the rights-based framework as a foundational piece that is central, but also understanding that this is something that goes beyond that. And I see that there's a question that's asking for us to repeat the name of the three women. So that's Patty Burns, Mia Mingus, and Stacey Park Milburn. And all of this can be found on Sins Invalid's website as well, right? So these are just some of the original origin stories of how this all kind of came about. And so when we think about disability justice, we think about how understanding this framework could really help us to better grasp how we can do emergency management a little bit differently, how we can do disaster assistance a little bit differently, right? So this is why we want to kind of get into it a bit more to say, how do we go beyond just 504 and the ADA, Title II of the ADA, which focuses on state and local services, but how can we kind of push beyond those things just a little bit, while also keeping them kind of centrally connected to the work that we're doing. We understand those as foundational pieces, but how do we use disability justice as a framework to reimagine the ways that we do this work? So let's talk about what some of the real principles of disability justice are, and we'll go on to this next slide, which says the 10 principles of disability justice. Now listen, I will not go into all of these in depth because you all will receive a whole handout that has all of these principles listed, and it also has a few questions related to each principle, and then actions to consider for every single principle. So it's a full, I believe, like 3-page full-blown handout, maybe 3.5 pages. So we won't spend a ton of time on that now because we want to give you guys enough time to really kind of dig through that in far more depth later on at your convenience and at your comfort. But let me just get into a couple of things here. One of the first things we think about is intersectionality. That's principle 1. And intersectionality is a term that was created by Dr. Kimberly Crenshaw, and it recognizes the multiple forms of discrimination and prejudicial treatment that's being faced by marginalized communities, and how those different forms of compounded discrimination really overlap and intersect in different ways that may very well, in our circumstances here for our conversation today, may impact how people prepare for, respond to, recover from disasters, fires, humanitarian crises, pandemics, and other types of emergency-based situations, right? So intersectionality is absolutely key. The second one here is leadership by the most impacted. And again, I'm not going to go through all of these, but I just want to tease out a few. Leadership by the most impacted is really critical. When I think about this principle, one of the first things that comes to mind is a quote by Rashad Robinson. Rashad Robinson is the president of Color for Change, and he has this infamous quote that says, "Presence isn't power." And I want to say that one more time. Presence isn't power. And this is important when we think about the illusion of inclusion. So having individuals who might just be present, but don't actually have the decision-making authority to change the way disaster assistance is done in their communities and their cities, or people who are casually consulted, but they aren't actually giving the ability to make some systemic and some substantive changes that are necessary to make sure that our communities survive. And that's key, because sometimes you'll have government officials or departments and say, hey, we talked to some folks with disabilities and we had some conversations with them, and then they go into their conference rooms and they go behind the scenes and they make decisions that are not necessarily driven by the priorities, the intentions, the interests of those individuals. So we want to talk about people with disabilities, not just as storytellers, but as decision makers as well. We can think about this in a couple of different things here. We also want to understand that we recognize wholeness. It's another principle here, and this is important because I love to tell people, when you come into a room, you should do so as your full self. Leave no part of you at the door. I'll give you an example that I give all the time. It was working in South Carolina, and I was working with a young transgender woman and her mother, and they were dealing with some implicit bias from the team that kind of present at the Disaster Recovery Center. Just some comments, some disparaging comments about this young woman and her gender, and they felt so uncomfortable with showing up there. And this young woman also has some mental health considerations, and the sad part for me about this entire scenario is that there was a willingness to address the mental health considerations, but also simultaneously this kind of explicit attempt to ignore the transgender component for her. And for her, having access to gender affirming medication and treatment and support was equally as important as having access to that mental health support for other situations that she was dealing with, other considerations that she was dealing with at the time. And so what is important about that is that you when you're working with individuals, you ask them to not separate or deny or close off any part of themselves, right? So she's like, I'm not leaving any part of me behind. You don't just look at me as a single kind of issue being, or kind of not intimately connected to all of these other aspects of myself. The same could be said for parents with disabilities, right? So it's like, yes, thank you for bringing an accessible van for me, but if I can't bring my children onto this van, and if I can't bring my mother, who I also care for, then I'm not getting on it. So it's recognizing the wholeness of these individuals. We think about this in terms of sustainability. So I love to talk about sustainability in terms of who is defining success. Are the communities defining success, or is it these kind of emergency officials who are coming in and coming out, or who don't necessarily have roots in these communities, right? Don't live in these communities, because sometimes it could be folks who live across the state or live across town and who don't live in communities that are the most impacted, and they are the ones who are defining what success looks like. And that's wholly unsustainable. So my metric for success may be my community garden opening back up. It may look like my local grocery store opening back up. It may look like the local daycare centers opening back up so that I can go back and forth to work. It may look like ensuring that all of the debris is cleared from the sidewalk so that I can independently navigate with my cane. All of these things are what would possibly be success for me. It probably wouldn't be some of the big issues that are kind of noted on anybody's checklist in terms of an official, but these are the things that look like success. These are the things that looks like a return to the way of living, the standard of living that we've all become accustomed to and that we loved before. That's what it may look like for our community, and it's important to prioritize your communities in this. We can also just point out a couple other pieces here in terms of collective access. So making sure that we work with different individuals with different types of disabilities to assure that access needs are at top of mind in recovery centers and at shelters and in hotels. All of that is absolutely key on websites as well. So we'll have folks who will say, we'll register on our website and call us, on our website if you need help, or call us on our line. And I cannot tell you how many organizations I have had to call on behalf of people with disabilities, or even on behalf of myself, where I've gotten the complete runaround on the phone. In fact, my electricity went out here the other night, and I tried to get someone on the line because there's certain assistive technologies that I have to use that make me highly dependent on power. And the electricity went out without notice. Now, they may have put some sort of notices around the building, but nobody told me anything verbally. So I had no clue that the electricity was out until I went to try to charge some of these devices that I rely on, and I had no power sources whatsoever. I called the emergency lines. You can't get anyone on the phone whatsoever. And if you don't press the numbers at a certain amount of time, the system could very well hang up on you, right? So we need to think about just some of the little ways that cause barriers and blockades to people, even in times of an emergency where you cannot get assistance, even if you call like the local 311 or 211. In my circumstances, I was told, well, you got to call the emergency line because we don't deal with that. So it's kind of going around this rabbit hole, just back and forth. And I'm someone who's extremely well versed on emergency issues, and I'm like, if this is the barriers that we're dealing with, we can only imagine what it is like for people who are far less well versed on these issues. The last one I'll just note here is collective liberation. I think someone put in the chat, nothing about us without us. I'll mention a couple, none of us are free until we're all free. Quote here from Dr. King. And then also Toni Morrison, who says that the function of freedom is to free somebody else. And so we think about looking at disasters and emergencies in terms of people who are incarcerated or who are in carceral conditions, such as nursing homes and psychiatric facilities. And how are we planning for them? How are we planning for folks who are in ICE detention centers? What does that look like for all of our individuals, our siblings with disabilities who reside in these types of environments, and how are they being planned for? Are we thinking about this in terms of people who enter into precarious positions as a result of the chaos that is caused before, during, or after a disaster? You have some individuals who really feed on those chaotic conditions, such as human traffickers and abusers. I work with the human trafficking group, and one of the things that they will tell you is that, listen, you don't find it unless you focus on it, because one of the greatest attributes of an abuser is their ability to seamlessly fade into the background and to become invisible so that you don't notice all of the harm that is being caused by their behaviors and by their actions. And so do we focus enough on individuals with disabilities who might be being abused by caregivers or by domestic partners in the midst of a disaster? Or do we think about people with disabilities who may be trafficked due to a lack of housing, a lack of supports after a disaster? These are conversations that we're all trying to have right now. So why do we need DJ and emergency preparedness? I hope I've given you a bit of a taste of that so far with some of the examples that we've expounded upon. But let's just reiterate just a couple of things here. Has been a lot of collective harm and trauma caused by the way emergency management has been done historically, right? We can think about tons of examples. We can go from Hurricane Katrina up to Hurricane Maria, up to the California wildfires right now. There's just multiple instances where people have felt as if they have not been heard. They have not been helped. There has been no true kind of resolution or reconciliation after a lot of that harm has been caused, other than saying, we'll try to get it better, do it better next time. And yet we see some of those same habitual patterns of harm continue to take place. And we'll get into many of those examples as we go throughout our presentation. We also want to acknowledge that disability justice is different from disability rights, which I think we've already kind of covered here a bit. We have to understand that justice isn't always achieved via legal means, and not everybody has equal access to legal support. So it's really important for us to understand multiple tactics to get us to a place of fairness, get us to a place that feels a bit more like freedom, a bit more like justice, a bit more like inclusivity and community. And that is what we're trying to look at in an emergency management context, and that's what we'll be talking about through the rest of our presentation today. All right, Valerie, over to you, dear.
Thank you. And so we're going to talk a little bit, this is Valerie, about some policy. This is a slide that we still have up. Justice didn't go through point by point, but this is just kind of some examples, kind of specific to the COVID situation that we have now, but are not necessarily something that we just see in COVID, that kind of gives an example of what Justice is talking about when we talk about that collective harm and that trauma that we have in emergency preparedness and management kind of broadly as a country. And we're going to talk more specifically about some of the harms that are experienced specifically by disabled people. But these are kind of some examples we've seen more recently. Punitive non-compliance measures, and this is actually not something that is specific to the COVID experience, but I think has come a little bit more into the general population's awareness with the issues that we're experiencing. So something like having government create laws and fines for not wearing masks at the same time that we have record unemployment and that we have a history of discriminatory policing practices specific to face coverings. Some of you might not be aware, but a lot of jurisdictions actually have laws currently that are exactly opposite of this, right? Where if you are wearing a face covering, something that obscures your identity, that's actually against the law, right? It might be a misdemeanor or something like that because of things like crime. And so you have a direct conflict and tension between, say, fining people for not wearing a mask when people don't have jobs. And then also saying, well, it's illegal for you to not wear a mask, but it's also illegal for you to wear a mask, right? So those kinds of things. The next point is solutions that have a limited scope. So this, I think, was a big one. It got a lot of traction on things like, on social media, but things like the bills that are the COVID stimulus bills that are being debated back and forth right now at the federal level. And I know this particular one got a lot of flack, where the Hills Act covered these 3-course business lunch reimbursements at a time where people aren't really going out and meeting face to face anyways, but didn't do things like protect people from evictions, right? And so there's a very obvious difference there in priority in how we're protecting people. And then this was, I think, a really kind of disability specific, or we really feel the effect as disabled people, but disinvestment in resilience in certain communities. And so this is a source that you can read of LA County as one of their punitive measures to COVID, threatening to shut off water and power to people who are doing things like having parties in their homes, which for those of us who have been social distancing and have been, stuck in our house for 4 months, not seeing people, that might immediately feel good to some sense of what we've been told justice is, right? Oh yeah, those people shouldn't be having parties, so cutting off their power totally makes sense. But when you actually think about what people need in a situation like a pandemic, or this is in California, things like wildfires, how do you wash your hands if your water has been cut off? How do you get access to the things that are going to keep you at home or keep you alive if your power is being cut off because you did something like social distancing? And so a lot of these practices really end up causing more harm in the long run. And that's part of why we need that disability justice. And so the next section that we're going to talk about, I'm going to go over some sort of general landscape experiences that people with disabilities have broadly. So this is not specific to COVID. And then I'm going to talk a little bit about how COVID and what we're going through right now in 2020 has specifically been affected by kind of these long-term problems that we have in emergency response and preparedness. So the first thing I'm going to look at, and I think this has been for the disability community, a long-standing issue that we're all aware of, and that's disability justice and services and supports. And so the landscape that we're at now, I know we have a lot, advocates and people in CILs and people who are familiar with this information, but right now we have for a long time have had a massive wait list for home and community-based services and waivers. As of 2018, that was at 820,000 people. And I think every time I look, it's pretty consistent of people who are waiting for services that they need, either to successfully live within their community, to transition into their community, to remain in their community, to get access to aids or healthcare or what have you. Additionally, I know many of us from the time that I was in the CIL, people before me, pushing for money follows the person to continue to have funding for these services. That was extended through a COVID bill, but still has not been made permanent, despite it kind of seeming like a very obvious time, at least in my opinion, to make that kind of change. When we talk a little bit about what we're seeing in congregate settings, what we're seeing in nursing homes and group homes regarding COVID, in my brain, this seems like a perfect time to make this kind of change, but that has not yet happened. In 2019, the Disaster Medicaid Act was introduced, the Disaster Relief Medicaid Act. That happened in June of 2019. That was, before this 2020 year that we're in, to try and address the issue of evacuation and people with disabilities and being able to keep your health insurance crossing state lines should you have to. And that was bipartisan. It was introduced in both the House and the Senate, but did not move forward. And now here we are in 2020, and we're seeing thousands of people that are having to evacuate from the West Coast due to fires. And these were exactly the kind of situations that we were trying to talk about in stuff like in bills like the Disaster Relief Medicaid Act. If somebody is reliant on that healthcare for their medicines, for their treatments, for just maintaining life, and then a disaster event hits and they have to evacuate to live with family or friends across state lines, they essentially have to start that program all over again. And so that's something we're seeing very much in real time now with COVID and with wildfires, but has long been an issue in evacuation practices that has been exacerbated by what we're seeing. And so when we talk specifically about HCBS, congregate settings, and being in the community and COVID, over 40% of the COVID deaths have been in nursing homes. I believe, and I think the consensus is that that's probably much higher. If you're not aware, it wasn't until about late April and early May that we started getting consistent reporting from a lot of these nursing homes regarding infection rates and deaths. And so this is missing kind of that whole first chunk for a lot of states of the first 2 or 3 months or so, where we were really seeing heavy infection. And that we know based on the hotspots that was congregated in nursing homes. So I think that this number is actually probably low. I have seen some federal meetings that have suggested that the number is probably over 50% of COVID deaths have been in nursing homes. We just don't have the numbers to prove that. But as we talk about going back to what Justice talked about, some of these justice principles, we can see in this next point that the systemic racism that we see in the general population very much has ramifications for people with disabilities. Nursing homes with at least 25% Black or Latin clients have increased rates of COVID. Now, 25% is a quarter. So we're not even saying nursing homes with a majority of non-white clients, but even just having a larger number of non-white clients are having increased rates of infection for both the clients and the people that are working in those areas. And so this is a really kind of visceral example of the way that those hierarchies that we see and those trends that we see as far as race and ethnicity and deaths in the general population is very much mimicked within the disability community. Direct support professionals, I know this is something that many of us have advocated for a long time, but they continue to lack living wages. They continue to have a shortage of PPE in the COVID situation, and they are frequently lacking worker protections to do their job safely. And this has been really exacerbated during COVID because of the need to, many of these direct support professionals might be working with multiple clients in a day, in a week, in a month. And when you're looking at 14-day, quarantine times to try to keep people safe, in a situation where we already have a direct support professional shortage and where they're not adequately being provided what they need to keep themselves safe, that becomes a risk to everybody involved. And a lot of people are not able to get into their communities or to get the services they need and stay safe right now, which is a major issue. So additional services and supports, language access. Some of you may have been talking about this with the recent videos we've seen come out from the president regarding his hospitalization, but language access has continually been an issue when it comes to getting information in emergency management. And so here's just a handful of some stats to kind of give you all an idea of what that means. I know in the disability world, we often think of language access specifically in terms of those who are deaf or hard of hearing. And so the first point we have here is that roughly 30 million people in the US above the age of 12 have some form of hearing loss in both of their ears. However, that's not the only language access issue we have in the disability community. We have disabled people in the US who don't speak English, whether that's ASL, Spanish, Arabic, something else. Over 67 million US residents speak a language other than English at home. That's a tremendous amount of people. 20% of our population go home and don't necessarily use English as their primary language. And so when we regularly don't provide access to information regarding shelters, information regarding things like food banks or mutual aid, evacuation notices, power outage notices, in languages other than English, when we see these widespread disaster situations, you have whole parts of the population that are potentially left out of getting that necessary information. Justice gave us a really personal and real-time example of that happening. Also, we have plain language and language competency. 1 in 5, at least as of 2014, between 2011 and 2014, 1 in 5, so again, 20% of the US residents between ages of 16 and 65 had what they consider low literacy skills. And so providing information in a way that is understandable to everybody also is a way of making sure people have the information that they need. And it's something that we're not really great at doing kind of in emergency preparedness in general. You may have seen an increase in ASL interpreters for daily briefings, which has been a tremendous win for the disability community. We are, 30 years after the ADA at this point. So the fact that that's still something we're fighting, though, is a little less of a win. And so that kind of brings us to the COVID situation. Some of you may have heard, even in 2020, the National Association of the Deaf had to sue the White House, of all places, as far as lack of ASL interpreters at COVID-19 briefings. So as much as we're seeing steps forward and wins in those spaces, we also still have a long way to go to make sure everybody can get the information that they need. I remember at the beginning when this was first happening, in trying to get information out to people, FEMA, if you did not know this, generally is quite good. Their website has between like 15 and 20 languages that you can get most of their information from. However, when COVID information first started coming out, you could actually only find it in English, Spanish, and simplified Chinese. And so despite the fact that FEMA generally has a pretty robust language access as far as non-English speaking people getting information, it took a long time. And I actually still don't think we have quite the amount of information available for COVID in the amount of languages that we have for other things. And with something changing as real time and being experienced in as real time as we're experiencing COVID, that leaves a lot of people potentially in danger and not able to make sure that their loved ones are being taken care of. Housing in congregate settings. This is an issue that I think has massively been exacerbated by COVID. Generally, when we talk about emergency situations, particularly that are regional, and we talk about things like evacuation and we talk about things like getting people safe, one of the big barriers that we experience as disabled people has been access to shelters. Where COVID has kind of turned this on its head is because of the need to social distance. And so even though we still have major problems with shelter access, this has, the COVID situation has put us in a situation where it's become more important than ever that people actually have access to privacy in their own space. And for many of us who have been doing housing advocacy for a long time, there have been many other reasons we've tried to push for this, but I think COVID has really made it evident why it's important that people have access to community housing. Currently, the landscape. The US has an estimated 7 million in affordable housing shortage. I know that we're aware that I always wrestle with how to word that, because it's not that we're short houses. It's that we're short houses that people can afford and that people have access to. And so right now, for people who need accessible, affordable, and that was before we hit COVID. That was before evacuations, or evictions, rather. When we start to talk about that intersectionality piece, 17% of sexual minorities, so people that are not cisgender, people that are not heterosexual, experience homelessness more than twice the general population. And so when we start talking about people who are sexual minorities, who are not cisgender or straight, their access to housing is even less than of the general population. Then on top of that, we talk about at least a quarter, and some estimates are up to about 40% of homeless individuals and unsheltered individuals are people with disabilities. And so again, we're seeing that the compounding of effects of maybe being somebody who is disabled, somebody who is part of the LGBTQ community, as well as somebody who needs access to accessible and affordable housing. And you can very quickly start to see how precarious and dangerous of a situation starts to form for disabled people who live in the intersections and the nexus of these identities. And then again, broadly, houseless individuals are exposed to poor air quality, which is a big issue when we talk about things like wildfires. They have the least access to consistent means of sanitation, which is not only a COVID issue, but that's an issue when you have flooding, when you have hurricanes, and they're exposed to weather extremes. Like things like hurricanes, extreme heat or extreme cold that we've seen. And so again, during COVID, some additional numbers. New York City has a houseless coalition that did a study and found that people that are unsheltered are dying 61% over the general population. I'm going to mess up the numbers, but I know for those who were unsheltered in New York City, it was well over 300 people per 100,000 people that were dying from COVID, versus the general population was over 100 and 100,000. So it was more than double if you were somebody who was unsheltered. And so we know so many of those people are people with disabilities. That becomes an issue that we have to worry about as people who do disability advocacy, or if you're somebody who does emergency preparedness work, to look at that situation as being different from the general population, because it is being affected differently. And then, of course, people who are losing their residence because of either loss of income, because of wildfires, because of the tropical storms. If you aren't somebody who pays attention to that, to things like extreme weather, I know it's really easy to not see that, because those tend to be a little bit more regional. But we have been experiencing hurricanes and tropical storms on an extremely consistent basis this season. I think for a lot of people, because of COVID, because of the George Floyd uprisings, and because we haven't had quite the impact as, say, a Katrina or a Maria, this has kind of been lost in the 24-hour news cycle. But a tremendous amount of the population have throughout 2020 been dealing with extreme weather events in their region, on top of this COVID experience, on top of potential unemployment. And so losing access to potential housing in those places, to social distance. Then we have a little bit more about congregate settings, because we do also have a disproportionate amount of people with disabilities in other types of congregate settings. And so a couple I have here are prisons, jails, and the ICE camps. And so we have some numbers here. We have over a third of people in prisons are people with disabilities. Over 40% of people in jails are people with disabilities. We know, and we've seen some of the reports coming out of ICE camps about the amount of the lack of, rather, healthcare being provided to people in those camps there. And so right now we have over 1,000 deaths of people that are incarcerated in prisons, an additional almost 100, over 80 deaths of people staffed. I do want to point, I mentioned this before, I had pulled up these stats maybe a couple months ago for another presentation. And at the time that I had pulled up the stats on deaths in prisons and jails, it was at a bit over 78,000. And by the time I pulled these were as of September 22nd for this PowerPoint, that had reached over 132,000. The amount of cases in ICE camps had went from, I believe it was like 41 or something when I had pulled out this data last time, to over 61,000 cases. So the spread is just something that really should be concerning to all of us as far as these congregate settings, and is probably being underreported, at least in our prisons and jails. And so that those are areas and those are populations that that we also need to be considering, because they are also disproportionately full of people with disabilities, and are also situations in which disability is created. And so people may have went into those situations and not been disabled, but are leaving those situations as part of our community. And so we're going to go ahead and look at some other challenges that I think Justice mentioned a bit, but we're kind of going to go through those pretty quickly. But other areas that we can work and need to focus on as people either doing disability advocacy or as people doing emergency management and trying to be broader focused when we do this work. Things like domestic violence. There have been several studies over several different events globally that talk about the domestic and intimate partner violence that increases during time of emergency. This is not just intimate partner violence. This is violence between parents and children as well that we see increases of. There's lots of hypotheses about why this is, whether it's that our response personnel are overwhelmed with an emergency event, whether it's increased stress, like because of the event that's going on, or lack of income or things like that. There's lots of.
Sorry. So sorry, I apologize. I thought I was muted.
Oh, that's okay. I didn't know if you had a question.
I was saying it could be all of them together,
Yes.
like a combination of all of them.
Absolutely, and it really probably is, right? There's a lot of different reasoning there. Evacuation challenges. This is a constant thing that comes up, whether that's transportation access. You hear stories like Justice mentioned, people not being able to bring families with them to, special needs shelters, which we shouldn't have, and is a whole other conversation. Things like not having accessible transportation to even get to a point of evacuation. Funding. We often don't talk about how expensive it is and the kind of financial stability someone would need to just up and leave an area if they needed to, right? That's not, for most of us, an option that we have and could do without bringing further risk to ourselves. I think one area that we don't talk about that I do want to highlight that I think COVID has really brought to the forefront is what we call the digital divide. And that's the lack between those who have consistent access to strong internet, and particularly with how much we rely on internet, and those who don't. That, I think, a lot of people have seen in real time how much information is changing on a regular basis, how much people are using the internet to access that necessary information and to stay safe. But also COVID has really highlighted that because of the reliance on things like Zoom meetings and remote work. Not everybody has access to high speed cabled internet in order to access these things, in order to keep working remotely, in order to get those daily press conferences, right? And so the access to utilities for a lot of people has caused a lot of problems, specifically in COVID. The other thing I just want to highlight is that this is often thought of as a rural urban problem, and it isn't always. There are plenty of people that are within cities that for financial reasons or other reasons don't have access, whether it's inaccessible. I mean, the past couple of years, many of you know, we've been in some back and forth regarding, web accessibility requirements, screen reader requirements, contrast. There's many different areas in which internet access is fraught, whether or not that's in a rural or an urban setting. And then just some other kind of COVID specific things with the amount of things that have gone online, things that you really need, going to Social Security offices, going to DMVs, going to meetings with parole officers. All of these are areas, we might have regular meetings with social workers, people who are transition coordinators, trying to get their clients outside of nursing homes or group homes and into private homes. All of that has been affected by not being able to meet in person. So we have a lot of different areas that I know many of us have tried to do work on for a long time that we're now seeing really exacerbated by COVID. And then I think we're going to stop and do some questions and then go to Justice to talk a little bit about resilience and moving forward and kind of some next step actions. So do we have any questions, Jamie or Marley?
I was just going to say, we have a clarifying question. When you were talking about the ICE camps, was the number 6,100 or 61,000?
100. I think I may have said 61,000, but yes, 6,100 is, and that's the current number of, and I'm sorry, this is Valerie, as of a couple weeks ago anyway, the number of infection for specifically people currently detained in camps. They have, you can go to, I'm going to mess up the website. It's sourced in there, but it's the government tracking website, and they have a whole chart that they have broken down by state, by camps, and you can see both ICE employees that are working specifically at the camps and their infection rates, and then ICE employees broadly as well. And then there's some varying numbers because of people coming in and out of the camps. But yeah, those were the numbers specifically for people that were in camps, and then the 45 number was staff specifically working at those camps that had been infected.
I have one question for you.
Yeah.
This is Marley speaking, by the way. You mentioned that 40% of individuals in nursing homes have been affected by COVID. There was an article that I read that stated people with pre-existing conditions who go to the ER or the hospital for some support would get transferred to a nursing home or a rehab facility. Does that 40% include them, or is this specific residents of nursing homes?
So the way that is partially, this is Valerie, going to depend on reporting. And I'm trying to remember, I think we're going to talk about that a little bit later. But for those who maybe don't know, there's a couple of things that happen with nursing homes. And so that number is actually 40% of the total COVID deaths were people in nursing homes. And residents of nursing homes. So that's not 40% of people that are currently in nursing homes. That's saying if we've had 209,000 deaths, 40%, at least 40% of those deaths for the entire United States have been people in nursing homes. Now there's a couple of things that happen in emergencies. So one, we do have, and we won't go into this too much, but there are waivers that are issued that are blanket waivers called 1135 waivers that come through CMS, through HHS, Health and Human Services. And what happens in a lot of states is one of the things that tends to happen with those waivers, it's not necessarily the only thing, but consistently with emergencies seems to happen, is that waiting periods for transfer from like an ER, for example, to a nursing home, those observation periods that you have to go through before a doctor discharges you either back into the community or to a rehab or to a nursing home can be eliminated. And so when you have a shortage of beds, what ends up typically happening is that you have certain people, people with disabilities, people with pre-existing conditions who get immediately moved from a hospital bed to a nursing home. The other thing that we saw happen that is a little bit different and is specific to the COVID situation, Marley, that might be what you're talking about, is I've primarily heard about this in New York. I don't know if it was only happening in New York, but there was some governmental decisions to move people who had tested positive and were sick to nursing homes, and that is being looked at as one of the increasing factors to people getting sick in nursing homes. But that was, like I said, and I think probably the article you were reading about was most likely talking about New York specific, whereas we know, for example, the Kirkland, Washington nursing home that is kind of considered one of the starting hotspots of COVID in the US, that wouldn't have been the situation, right? And we still know that that was just massively went through the Kirkland nursing home and took a lot of lives, and a lot of people got sick even before those decisions were starting to be made. And we're seeing that consistently across the US, kind of regardless of whether or not that practice that was happening in New York is happening. But considering what we saw in New York, I think that's, I mean, there's definitely conversation that has been happening and needs to continue to happen to address why it was thought at any point during COVID that was an okay move. I think there's a lot of people who don't understand why that decision would have been made, and would really like some answers as to why that decision would be made. But I would not, that larger 40% number, I don't think it would be accurate to say that the number got that high because of those practices, because we also know in places where that wasn't happening, that we've seen tremendous amounts of sickness and death within nursing homes, even when it wasn't a part of the regular care practice to send people to nursing homes when they were sick. But that is as far as putting people in nursing homes that wouldn't traditionally be put in nursing homes, that is a regular practice of emergency management. So that kind of goes back to what Justice was talking about these kind of systemic harms that we see when emergencies happen. And it really goes back to really decade after decade of determining who's valuable and who isn't, and saying, well, I guess I've said this so many times at this point, but one of the first things I think that kind of told us all that this COVID experience was going to be really, really particularly exhausting for disabled people was how many people in February and March were saying, oh, it just affects old and disabled people, we don't need to worry about it. And that right there set the stage of how valuable we were as disabled people, or as older people were to kind of the general population, that was sort of the attitude, right? And so now trying to fight back against that and make sure that people are getting what they need. But does that answer your question?
Yeah, thank you.
And I'm gonna kind of wrap us up a little bit. So Valerie spoke a lot about many of the policy considerations and things that we needed to go through to really contextualize the conversation a little bit. And here we're just going to talk about some of those structural changes that we all are advocating for and kind of can continue to advocate for moving forward. So we look at this, even if we're talking about just the landscape, some of the accessibility provisions that have been made that we have been advocating and asking for years, even after the delivery of the ADA in 1990. How many of us have still been advocating for things like the ability to have more flexible work hours and to telecommute, and to have, kind of a shortened work day. Whatever the case may be, a lot of these basic accommodations have been made readily available during the pandemic because it affects a large, everyone. And so the thought here is, well, now we can put some of these things in place, whereas before we didn't think that they were at all feasible. We immediately assumed that it would be too financially taxing on our organization or our corporation to do so, or we didn't feel like individuals would adhere to basic standards of productivity, which has its own problems and being deeply rooted in ableism, that concept that your overall worth is directly attributable to what you're able to produce, and the failure to produce thus means that you are unworthy of basic considerations and accommodations. And that's a flawed frame of thinking, and we all know that in our basic understanding of ableism. But these are the conversations that are happening right now around making sure that many of the accessibility wins and some of the creative and innovative things that's been happening, that those things continue moving onward and that it's not lost after the pandemic goes. And also making sure that we continue to protect employees. So certain emergency policies and guidelines that's been created by employers and by organizations, corporations, even cities and communities, to make sure that those that same level of attentiveness and responsiveness continues onward throughout the disaster. So really giving a kind of a deep dive type of mindset, but really trying to make sure that we kind of keep the things that work and of course let go of the things that don't. If we think about this from the medical perspective, there have been some really cool things taking place, such as community paramedicine programs that have happened. And so some people are asking, well, can this continue? And these are individuals that are EMTs and first responders coming out to do proactive medical visits with families and with individuals, right? So Valerie talked a lot about home and community-based services. And so in the absence of some of those programs, or in the gaps when those programs are not, meeting all of the needs that are in a community, having some innovative alternatives to help come in and support, although we clearly need to make sure that, those home and community-based supports are as robust as they possibly can be, but having additional streams of support are also a couple of things that folks have been calling for. And so you see these pop up in different communities where you have, instead of folks going into hospitals and trying to just see their primary care physicians for things like flu shots and checking they're doing a consistent check-in on their diabetes or other medical conditions that they've had for quite some time, but just doing some of the basic checkup situations or scenarios or procedures, that can be done in a multitude of ways. And so will that continue onward after the pandemic? That is a question that people are asking, and it's certainly something that folks are calling for. Folks are also looking at, what do these immunity clauses look like, and wanting to make sure that those types of things don't continue as a way to shirk responsibility for discriminatory treatment that people with disabilities have faced in nursing homes and other congregate settings. So making sure that these types of immunity waivers or clauses, that they aren't put in place as a means of saying, well, hey, they were individuals with disabilities, we did the best we could. They were going to, as Valerie was saying, the only people who are going to be affected are older folks and folks with disabilities. So this is not anything that we could have necessarily prevented, but making sure that those types of clauses aren't put in place as a means of evasion, right? To evade or avoid responsibility when people with disabilities are are dying every single day as a result of this virus. And in many cases, all of these circumstances need to be viewed on an individualized basis, of course, but there is certainly an overwhelming consensus that many of these deaths were preventable, right? And so losing sight of making sure that people are held responsible for that, however high up it goes, is very essential. And a lot of folks are having these conversations right now. Again, as we talk about structural change, as we talk about true resilience, we also have to look at this in terms of the way that our rationing schemes are set up moving forward. We uncovered a lot of problematic protocols across the country. And I, of course, work with the protection and advocacy system. So you had PNAs in Washington and Alabama, Tennessee, just New York, all over the country, who were calling for greater clarity and changes to be made for the way that their governments, their governors and their the kind of senior government officials in their state, the ways that they were rolling out these rationing plans, right, in ways that identified the quality of life for individuals with disabilities in a way that was completely demeaning and dehumanizing for individuals with disabilities. Now, this had, of course, a lot of ableist attributes and connection, but it also, of course, was deeply steeped in racism as well. This idea of the kind of comorbidities or pre-existing conditions and having that be kind of the main metric of deciding whether or not someone was worthy then of life-saving, life-sustaining care, and how individuals with disabilities, Black, Indigenous, and people of color, all of these individuals were being disproportionately impacted and discriminated against because of such protocols, and how problematic that was. Another thing that I'll just mention here, is not noted on the slide, but if you have a few additional moments, I would highly encourage you to check out the weathering theory. And it speaks about how it talks about the physical ramifications of discrimination and prejudice and microaggressions and macroaggressions, what that physically does to the body. And particularly the study started by focusing on Black women who were giving birth, so Black mothers. But then it also kind of expanded out over the years to talk about all of the different ways that discrimination has a very cellular impact, kind of cellular shifts and cellular changes on our makeup of our bodies and what that means in terms of our ability to kind of develop immunities and develop kind of the immune system necessary to kind of ward off a lot of these diseases and a lot of these problems that come up during a situation like this, such as a pandemic. So if you have the time to check that out, I'd highly recommend it. It is unbelievably fascinating, but it lets folks know that it kind of boils down the conversation to, listen, you have to do better, and you have to take care of yourself, and yet we will continue to discriminate against you, stress you out to all means, and expect for you to be in tip-top condition, the best possible position to be able to respond to and recover from a disaster, an emergency, a pandemic. And that's really what we're talking about here when we talk about systemic changes. A lot of people right now are trying to continue to unlock and swim through the multiple forms of structural violence and what that means in relation to the slow onset disasters, so things that just take quite a while to reveal themselves, and then also the sudden onset disasters. So things like poverty and education and housing, all of the things that we've been talking about thus far, and the absence of those of certain supports, how that only exacerbates the conditions and makes it even harder for individuals to be able to withstand the impact of a storm or an emergency-based situation. So making sure that we give people more to work with than just the standard emergency tropes, such as just prepare and think ahead, and kind of laying the onus completely on communities that are really hit on a daily by different types of crises. And I think Valerie spoke a little bit about this earlier, but it's difficult to talk about a disaster that may come a couple months from now if you're literally dealing with a daily crises such as how are you going to feed your family, or if you're dealing with the crises of potentially being evicted and being homeless, or dealing with the crises of not having access to clean drinking water and knowing that the water that you are drinking is making you sick, but you can't physically get down to the grocery store, which is about 2 miles away from your neighborhood because you live in a food desert, to get additional water and supplies and the things that you need until someone perhaps comes over and gives you that assistance that you need, or you're able to gain access to paratransit again, and for whatever reason that service may or may not be working or functional in your area. All of these are considerations that people and decisions and conversations that people are having on a daily, and we have to continue to think about that from a policy perspective as well, because it plays a very heavy role in whether or not somebody is able to participate in all of these things that we dream up and that we plan, right? And so one of our last slides here is that these calls to action. So many of you who are on the line right now are advocates and people who work in disability spaces. So we're just looking for a couple of different things here that we encourage folks to do. And again, you'll see some of these things echoed in the handout that you'll get. It'll have actions to consider under every single disability justice principle. But we just boiled down a couple of things. One, let's go beyond the go bags. As we were saying before, let's think about this in terms of systemic change. So how are the rivers being dredged? How are we thinking about this in terms of the waterways? Are we thinking about this in terms of when we are rebuilding houses, literally rebuilding houses? Are we doing it with durable supplies and material that will be able to withstand hurricane force winds the next time? What are we doing in terms of making sure people have access to all of the information and supports, the infrastructural supports that they need in order to return to their communities? Are we monitoring commercial investments, right? Like, so are we continuing to disinvest in our communities and then always be in a state of wonder as to why they are always disproportionately impacted by a disaster? So if we continue to disinvest in those communities, the results will continue to be replicated time and time again, whereby they will be disproportionately and most harshly impacted every single time there is a storm. So how can we better invest in communities in ways that don't take away their capacity to kind of survive and also thrive after a storm? So that looks like different types of development. It doesn't just look like, well, let's put a big stadium in this community, but it looks like let's invest in kind of green infrastructure, or let's invest in sustainable waterways and drainage systems. But those are the things that we can also kind of be thinking about. We also need to think about this in terms of climate gentrification. So who's coming back into these communities? I cannot tell you how many conversations I've been a part of where both emergency managers and outside influencers such as corporations and organizations will come in and say, hey, this is a blank slate. we can, we can really do some great things here. And the thing that always makes me cringe about that blank slate mentality is that it completely ignores all of the color that existed on that canvas before they walked into the room, right? So you have all of these people, these communities, these cultures, these experiences that still exist on this canvas, although these people who are making decisions may choose to ignore them. And therein lies the problem. And that's something that we want to get away from. So you even saw this in Puerto Rico, and a lot of protests emerged in Puerto Rico, where you had kind of Silicon Valley folks and different investors from different corporations who really wanted to come in and buy up a lot of the land in Puerto Rico following Hurricane Maria. And folks were like, hey, we're still here. You can't just completely wipe us out. This is our ancestral land. We've lived here for generations. You can't just erase us. And not include us in this conversation and say, well, we can work in these hotels, but we can't live in these communities. We can work in these, and some of these businesses as support staff and things like that, but we can't actually afford to live in these communities anymore. So yeah, you're doing development, but it also displaces us, or keeps us displaced. So that's really very important to think through. It also is important to think about where the funding is going. So let's make sure that that's being done in a way that really supports community-driven mitigation measures, and not just something that people, is telling a community that they need, or are kind of being these kind of prepackaged prescribed solutions. But what are the communities themselves saying? Listen, I know that that's been done in 5 other disasters, but what we need here in rural Ohio is A, B, and C. How do we get to those places? Insist that people with disabilities are fully a part of community risk reduction programs. So every city will have some sort of community risk reduction plan, and sometimes it'll be your emergency management agencies or your fire departments, but all of the first responders, emergency management officials, they have some sort of knowledge or involvement with what these plans look like. Having a conversation and making sure that the community's perspectives are intertwined and kind of at front of mind with these sort of plans and processes are absolutely essential. And then lastly, we want to make sure that we urge government officials to make sure that people with disabilities are included in all parts of responses and recovery, and making sure that that funding is being put in the hands of individuals with disabilities as well, right? So not just that we'll take care of what we think and what we assume people with disabilities need, but saying, okay, what are the organizations that are for and by people with disabilities who are out here doing the work that we can provide direct support to, and not just thinking about this in terms of theory, but also understanding this in relation to practice. So the groups that are out there helping to make sure that the accessibility changes are being made that are in terms of the physical atmosphere and the environment that people have to navigate, but also making sure that some of the other priorities and interests that people with disabilities have across their communities are also being put forth in a more actionable way. And that's going to be best determined by those individuals themselves, not by any outside or exterior entity. And with that being said, we are going to open it back up to additional questions, and our contact information is right here. But we really would love to be in discussion and in conversation with you all. So if you all have any additional contributions or questions, or just anything that you would like to kind of throw out there to the group, we would love to hear it. We're here for the next several minutes, so we would love to convene with you that way. So I'll toss it over to Marley to see if she has anything to launch us off, or if there's anything that folks have alluded to.
And this is Valerie, if there's not, I guess I saw some of the names that were in the chat before I started screen sharing. I would like, if there isn't questions, to kind of pose a question to you all to get for the work we do. What are you seeing in the work that you're doing, or what barriers are you coming across that you're trying to address? Is there some way that we can speak to that? Or how have you seen, kind of as we've talked about, I think one of the big things that's happened in COVID is it really has brought to the kind of awareness of the general public some of the issues that we have been advocating for a long time. I'd be really interested to see if you're seeing that play out in Ohio, or if you're seeing that affecting your work, or if you're, has that been, I would love us to have a little bit of a conversation on that, to see if there's anything that either we can learn from the work you all are doing on the ground, or that we may be able to provide information on, or tips or suggestions or illuminate or anything like that. So
I do have a question for you. This is Marley speaking, by the way. One of the things that has kept me sane throughout this whole COVID pandemic is the excitement of where we can take disability accommodations. What are some like suggestions that you guys would have for us to keep that momentum going and keep it on that right path for people with disabilities even after COVID disappears? Because eventually things are going to go back to normal. People are going to go to the office, and employers might not want to give you that flexibility. So how do we keep that momentum going and drive this home for all people with disabilities?
Hi there. This is Justice. I'll just give an example that has been useful in the past, and that is keeping a record of everything that your organization has been willing to do during the pandemic. So it kind of it brings up and it kind of eats away at the excuse that it just can't be done, or that it was too cost prohibitive to do, or it was too inefficient or inconvenient. And it goes to show like, hey, no, that wasn't happening. In fact, that was, there was no complaints about the standard of work of the staff. And all. These are some of the excuses that organizations constantly trot out, right? It's that people aren't going to be as productive, as I was mentioning before, people aren't going to participate as much, and that you only have to do it this one way, otherwise it can't be done. And I think showcasing some of the many examples of, hey, no, it could be done, and it worked really, really well in these different circumstances. And I think that needs to continue onward. I think it really also does help to have additional folks stand up together in terms of advocacy. And I think this is important because one of the other principles of disability justice is cross-disability solidarity. And so even if one issue, isn't impacting you or your particular type of disability, but really standing up and advocating alongside an individual with a disability who it does impact, and saying, no, as a disability community, this is important and these accommodations need to continue. And working not only with organizations and corporations, but also governmental agencies as well, because making a lot of these town hall meetings. So again, we're talking about structural change here and talking about ways to continue advocating. A lot of these council meetings and town hall meetings, all of them have gone virtual. And folks are saying that needs to continue because I've never felt as if I could be a part of that process before, because they happen super late at night when or they happen like they interrupt my dialysis treatment, or it's really terrible to get a paratransit during rush hour at that time. And I cannot foresee myself spending 4 hours just to get back and forth to go to one of these town hall meetings and getting me home so late at night. And so my goodness, the access to just my civic participation has been opened up, and that needs to continue as well. So I think us coming together to help collectively advocate for one another and pushing and making sure that that continues is really important.
This is Valerie. I think Justice nailed it. I'm a little petty, so I remember when this first started happening, I had a friend who needs remote work and who was in the process of looking for a job, and I told them that they needed to, what I would do was go and find all of the places who they had had interviews with who said they couldn't work with them remote, and find out if they had went remote in COVID to call them out. But there is I think keeping records, but I think the other thing, and I'm surprised we didn't really talk about it, because I try to make sure, especially when I talk to people that are either advocates broadly for people with disabilities or people who do emergency management work, to try to make sure to bring this point home. I do think, though, that when we talk about going back to normal and what that means for people with disabilities, that is also going to change, because while it's been extremely heartbreaking and upsetting to think about the 208,000 plus people that have died, we have had 7 million people infected with COVID. And every day it seems that we are learning more and more about what I'm seeing, at least on Twitter and things, people are calling it long COVID. I don't know if the scientific world has created a specific name for it, but there have been studies about lung function after COVID, neurological deficits after COVID. We are still very much learning what it's doing to people's bodies. And it seems to be that people are having very long-term ramifications, even after they have gotten better from COVID, right? Or recovered from COVID. And so I think what's also going to happen is that our new normal is also going to include just a massive increase of the amount of people who need accommodations. Whether or not they consider themselves disabled is a whole other conversation, but people who are no longer able to walk a certain amount of distance without running out of breath, people who are more susceptible to getting sick, people who are experiencing things like brain fog and confusion and might need a little bit more time to process things, right? And so I think part of what's really going to help us have that strong voice that Justice mentioned is also letting kind of those new people coming into our community and making sure they're also aware that they have a right to demand more, because the prevalence of ableism in our society means a lot of those people who don't have access to disability community and culture and aren't aware of things like disability law are maybe sitting there thinking, oh, well, now I have these problems and I can't breathe and I can't concentrate and I don't know what I'm going to do. And they don't know that they can demand that they be accommodated, right? And so I think, and considering how many people are being infected, I think we might be tapping into some power sources that we didn't have before, as far as whose voices are heard when they need to demand accommodations. I think the other thing that gets lost in the conversation on resilience when we look at forward that I like to bring up is our aging population. A lot of people are aware that 2030 is kind of our tipping point. And there are counties in Ohio that are estimated between 2030 and 2050 to be a quarter of the population. So 1 in every 4 people that you run into when you're out and about in your county are people over 65. And so we also know that a lot of people in those populations don't consider themselves disabled. They just consider themselves older, right? But they have needs that need to be accommodated because of the aging in their bodies. And so I think when we talk about this new normal and what the next 5 years or 10 years or 20 years are going to look like, we are going to see such a tremendous increase in access needs, whether or not we see an increase in people considering themselves disabled, that I'm hoping we can provide enough education and resources that it's no longer able to be pushed aside as something that affects a small number of people. Now that might just be me being optimistic, but that's kind of what I'm thinking. We're going to start seeing some of that change, and have already started seeing some of that change.
We do have one wheelchair user, physically disabled worker, who was sent home right when COVID started to protect her, but who was advised to use her own computer to connect with her unit remotely, and has never been able to connect despite requesting help to get the software working on her computer. Only now, after this many months, is she being supplied with a laptop that has the correct software installed. The months between have left her feeling isolated from her own workforce, despite still being paid. No one wanted to go out to her house to help her because they were not going to anyone else's house to help. I am her friend and did go over to her house and tried to help, but I could not get the software to work on her own computer because I am not an IT person. So special regard needs to be given for certain needs due to disability, despite policies to not go to employees' homes.
This is Justice. I could not agree more, and I don't even think much else needs to be added to that. I completely concur. I think that's some of that was just an absolute failure of that organization to provide the bare minimum in terms of accommodation so that this person could continue working and continue participating with the rest of the, not only just the organizational culture, but also in terms of what her duties and responsibilities was as were as an employee. So that was an absolute problem on their part. And then also this idea that, well, we're not doing it for everybody else, we're not going to do it for you either. I mean, that is the exact reason why we have the ADA in place, is to make sure that we're not looking for equality in that sense. Well, let's just not provide anybody with anything. We're looking for equity in terms of making sure that people can have equitable access to the workforce and her circumstance, and still be able to participate and achieve whatever goal. And I think about all of the professional development and growth that person missed out on. I think about the team building activities or anything that was happening on a kind of an online front that she missed out on, and whether or not that is going to be negatively represented in her performance reviews. reviews at the end of the year. These are conversations that are the residual effects. This is what we're talking about. Like, it may not happen when the news cameras are on, right? Like, these are not the thing. This happens in every single disaster. The news cameras will leave and everybody will still tell you, but hey, the problems persist. We are still dealing with some of these issues. So you think about kind of the long-term ramifications of being denied access, and whether or not she has an expanded workload now, or whether or not she's being expected to follow up on all of the projects and assignments that you know, kind of were backlogged, and whether she's being asked to do that in an unbelievably unreasonable amount of time. And trying to, you know, catch up with her counterparts and her peers. These are all questions to ask. I would say, you know, one thing that I wanted to just hint on is something that Valerie mentioned in terms of this idea of normalcy and kind of getting back to normalcy. And we can all understand that even the mere concept of normalcy is really centered on ableism as well, this idea of even, you know, what is normal. But I also wanted to acknowledge just the different ways of doing work, and hopefully bringing people who are acquiring new disabilities as a result of COVID, bringing them into the fold and helping them navigate this space in terms of accommodations, but also in terms of community and culture, and how important it is to know that, hey, people with disabilities are saving themselves, because we've always had to. So you have people with disabilities who are sharing techniques and tactics and strategies on how they are surviving. They are literally providing each other with material support, and in some cases, financial support, medical support. I did not know until I was like 28 that it was okay to work from my bed. I never even thought that was something that could happen, that I would still be, you know, able to be viewed as, but it was okay for me to do that on days where I could not get out of my bed for any number of reasons, or days that it just was not feasible for me to go out and do something in a certain way. So it's all of those things are really important to just understand and conceive a new way of being. This is what we mean when we talk about a reimagining of what is possible. And I hope that if you all take nothing else, please take forth this message. All that you know, all that you learned, all that you have experienced, please take that forth and share that with individuals who are newly acquiring their disabilities, or people who have disabilities but have never been a part of the community. They are absolutely, those insights, those ideas, those perspectives are absolutely critical when we think about them in an emergency and a disaster context, where time and connections and community are paramount in terms of our collective survival.
I would like to also mention that there is the Job Accommodation Network that you can look up for resources when it comes to your rights and your responsibilities in the workplace. We also have 2 ADA coordinators in our office that should your friend / coworker want guidance, advice, someone to talk through the experiences that she's dealing with right now. We have 2 ADA coordinators that they would be happy to talk to you. And unfortunately, the ADA is a complaint-driven law. So the more of us that we complain, the more of us that put in those complaints, the more likely these changes will occur. I personally hate it. I don't agree that it should be complaint-driven. These are social human rights. They should just be given to you. But yes, we definitely need to complain in order to get anywhere right now. So if your coworker, Julie, if your coworker would like some guidance, we'd be happy to talk to her. I would like to say thank you for Valerie and Justice for this awesome presentation. This was fantastic. I would like to thank you, Jamie, our tech person, for your assistance. I would also like to thank PRI Captioning for their fantastic services. They'll be with us for the entire duration of this series. On Friday, we have another presentation for you, October 9th. And that one will be the politics of emergency readiness. So where those funds come through and how it's distributed between your city and community. We will have Marcy Roth from the World Institute on Disabilities discussing this topic with us. So we're very, very excited to have her join us. She'll be giving us tips on how to be better advocates for our policies and change of procedures, and on a local level. Please don't forget that we have a lot of free emergency readiness supplies to hand out, and the list can be found in its entirety on the flyer. Please be on the lookout for the PowerPoint presentation and resources, which will be sent out shortly after this presentation. Thank you all for joining us and have a great Monday.